Today, President Obama is scheduled to speak at the White House to tout the benefits of his signature health care law, the Affordable Care Act. But would doctors across the country agree that it's working out? According to a recent survey, 62% of doctors plan to retire early in the next 1 to 3 years. One of those doctors joins us right now. Dr. Robert McWilliams is closing his practice after 40 years serving the people of Texas. He joins us from Houston today. Doctor, good morning. The Health Care Act goes into effect in January. What are you doing in February?
I will retire out of 40 years of medicine, Steve.
Why?
The bureaucracy of the government today has prevented my ability to continue to provide my patients with the excellence of health care that they expect out of me as a physician, and they demand from me as a physician. As long as the costs go up and the reimbursements go down, I cannot continue to provide the excellence of care I have been allowed to provide for the last 40 years, and that's really a shame.
It is a shame. So what sort of reimbursement reduction are doctors looking at come January?
Well, let me start first, Steve, with, for 15 years, we've seen a reduction in insurance reimbursements based on governmental decline in Medicaid, Medicare reimbursements. So it started 15 years ago. So we've got a decline in our revenue and an increase in our overhead. It's just forced us to see more and more patients, which has limited the excellence of care our patients demand. Let me give you an example. The average office visit today in the United States is 7 minutes. I don't believe I can provide my patients with the excellence of care and educate them toward them understanding that care in 7 minutes. I just can't do it.
Let's get personal for just a minute. Since 2010, I am led to believe, that's when the last time you took a salary was, because all the rest of your money, you've been living off your personal savings, operating as a medical doctor, and everything you've been putting back in your practice, right?
Yes, sir. I haven't taken a paycheck home from my practice since October 2010. I've remained in medicine because it's what my life is all about. It's my desire. It's my love. I love my patients. I love my office staff. I love my Lord Jesus Christ. But, this is tearing me up because it's something I really, really consider a privilege in this country to do. And I've spent about $200,000 out of my personal savings to continue this practice of medicine. But I'm to the point where I'm bleeding so badly, I can't continue to bleed any longer.
I understand you told one of our producers you made a pledge to give excellent care or no care at all, and that's what's going to happen in February, isn't it?
Absolutely. I think, to be honest, all physicians desire to give their patients the best of care. When that is taken away from us, Steve, then the desire, the joy, the satisfaction we get out of our profession is gone. And when that's gone, we don't feel good about compromising care if that's the reason we're in medicine in the first place.
Well, it's hard. I'm sure it's been a heartbreaking decision, and we can tell by your passion.
It has been.
You're a great doctor.
It has bothered me for a number of years.
Well, good luck to you. Dr. Robert McWilliams joining us today from Houston. Good luck, sir.
Thank you.